Let's learn how to treat anterior radial head with muscle energy treatment. Patients are seated with the arm flexed to 90 degrees and relaxed. Physicians are standing or seated in front of the patient. Doctors, contact the distal radius around the wrist, but do not cross the wrist joint. With your palpating hand, contact the radial head with your thumb and index finger. Anterior radial head's restrictive barrier is going to be in the posterior radial head position. So with your palpating hand, contact the radial head, lay or palpate, and then see if you can engage the restrictive barrier statically. Here, radial head is engaged at the barrier by encouraging the posterior position. Also, this barrier will be enhanced by pronation of the forearm. During the muscle effort, patient will supinate while you pronate, resisting patient effort. Also at the same time, you will resist radial head motion, encouraging the posterior position. Hold this for 3 to 5 seconds. Stop muscle effort. Move to the next restrictive barrier by pronating further and encouraging further posterior position of the radial head. Once new barrier is engaged, repeat muscle effort. Hold isometric contraction for 3 to 5 seconds. Ask your patients to relax and then engage the next barrier. Repeat this at least 3 to 5 times or more until the restrictive barrier improves. Complete the treatment with final stretch, engaging the last restrictive barrier. We're going to move on to posterior radial head muscle energy treatment. The initial setup is exactly the same as the anterior radial head. Since the restrictive barrier is anterior, we're going to try and encourage the radial head to move into the anterior position. Also, we're going to encourage this by supinating the forearm as well. Initiate muscle effort by asking your patients to pronate their forearms. You should resist this force and hold there for 3 to 5 seconds. Start muscle effort again. Patients should be pronating and you should be supinating and resisting. Just like before, also you should be encouraging the anterior motion of the radial head. Stop, and you can repeat this at least 3 to 5 times or until the restrictive barrier has resolved. You should finish the treatment with the final stretch through the restrictive barrier.